self-esteem, your emotions, your coping skills. All these things play a role in people having mental health. Then social, the socio-economic status, the family background, where you grew up. There are certain, especially with the issue of substance use, what you realize is that if a child grows up in an environment where people abuse substance, there's a high probability that that child will abuse substance. So now we'll go through a few of the common mental health disorders. Depression. Let me start with depression. So depression is a common mental health disorder. Globally, an estimated 5% of adults suffer from depression. And more women are affected by depression than men. And one of the studies has shown that it is because women are more likely to talk about their issues with depression. Women are more likely to seek help than men. Depression can lead to suicide. Therefore, there is effective treatment for mild and moderate severe depression. Depression is different from regular mood changes and feelings about everyday life. So when we say depression, once in a while you get sad and you have a low mood. But when we say depression, it is a feeling of this low mood, which is persistent every day throughout the week. So like you are feeling the low mood, low energy, loss of interest for like about 20 hours of the day. Even if there are things that are supposed to excite you, you are not excited about it. And it is persistent for at least 2 weeks. Persistent for at least 2 weeks. That is when we say somebody is having depression. And it can affect all aspects of life, including relationship, family, friends, and community. It can result from or lead to problems at work and school. Because most of the time, the person will have a loss of interest, there is low energy, they don't have the energy to come to work. Even if they come to work, they seem apathetic, but it is because they have lost interest. And depression can happen to anyone. People who have lived through abuse, severe losses, or other stressful events are more likely to develop depression. During a depressive episode, a person experiences a depressed mood, that is feeling sad, irritable, and feeling empty. They may feel a loss of pleasure or interest in activities. A depressive episode is different from mood fluctuation, like I said. They last most of the day, nearly every day, for at least 2 weeks. What are some of the signs and symptoms of depression? The signs and symptoms of depression include poor concentration, feeling of excessive guilt or low self-esteem. There is hopelessness about the future. There is thoughts about dying. There is disrupted sleep, what you call early morning weakness. So normally people begin to wake up like 3 hours before their usual time. So if the person used to wake up, let's say at 5 a.m., they will now be waking up at 2 a.m. instead of the 5 a.m. There's changes in appetite and weight. Sometimes they have loss of appetite. Sometimes they have changes in weight. Then there's feeling of tiredness and low energy. Then we go to anxiety disorders. Anxiety disorders are the most common mental health disorders in the world, affecting about 301 million people. More women are affected by anxiety disorders than men. Symptoms of anxiety often have onset during childhood and adolescence. So one of the studies that I found said that children who have low self-esteem, let's say a child is in the house, is being shouted at, you cannot talk, you cannot do this, you cannot do that, you cannot do a lot of things. Like most of those children who grow up to have issues of anxiety disorder. And there's also effective treatment. Approximately 1 in 4 people with anxiety treatment receive treatment for this disorder. Everyone can feel anxious sometimes, but people with anxiety disorders often experience fear and worry that is both intense and excessive. So you see, we are all, assuming we all see a snake, we are all afraid. However, people with anxiety disorder, the fear is both intense and excessive. Even after the snake is gone, they can't sleep at night. They are still thinking that the snake will come to their room and they can't do anything about it. These feelings are typically accompanied by physical tension and other behavioral and cognitive changes. They are difficult to control. They cause significant distress and can last a long time if untreated. Anxiety disorders interfere with daily activities and can impair a person's family, social, and school or work life. People with anxiety disorder may experience excessive fear or worry about a specific situation. For example, a panic attack or a social situation. In the case of generalized anxiety disorder, it is a broad range of every situation. I happened to see a patient who lost her Ghana card and she became anxious for months. Even after the Ghana card was found, she was still anxious that she will lose it again and she will lose her citizenship. They typically experience these symptoms over an extended period, at least several months. Some of the signs and symptoms of anxiety disorder is trouble concentrating or making decisions, feeling irritable, tense, or restless, experiencing nausea or abdominal distress, having heart palpitation, sweating, trembling, or shaking, trouble sleeping, having a sense of impending danger, panic, or doom. Then the almighty schizophrenia, where people take off their shirts and maybe wander along the streets. It affects male and females in equal proportions. And some of the signs and symptoms of schizophrenia is hallucination. So hallucination is perception in the absence of a stimuli, in the sense that when they are there, they hear voices talking to them like the way I am talking to you, but they are the only ones that can hear. So sometimes you see them, they are there and it's as if they are talking to somebody and they are making gestures or they are laughing, or sometimes they are afraid, they are leaving the house because they say a voice has told them to go here. Then they have delusions. There's a belief that maybe somebody is trying to kill them, somebody is trying to harm them, somebody is trying to poison them. Then there's disorganized speech and thought. Sometimes if they are speaking to you, what they are saying does not really make meaning. You cannot make a head and tail as to where they are going. Then there is loss of interest. There is evolution where they are withdrawn, they don't want to do anything. They have a blunted affect in the sense that whatever conversation you are making with them, their facial expression does not change. It remains flat throughout. Then there is inability to process social cues. You are telling them something, they are looking at so. Then there is the bipolar affective disorder. So I've talked about depression. The other side of the depression is mania, where everything is high. So the person is feeling euphoric, they are happy, they can't sleep. Sometimes all of a sudden they want to start a church, they are preaching everywhere, they are excessively spending, they believe that they are the richest people in Ghana and they are overspending, they are hypersexual, they are talking excessively, you can't even interrupt them. There is a high sex drive, they want to have sex with everybody. That is mania. Then there's what you call post-traumatic stress disorder, and this normally occurs after a trauma. Normally, sometimes after an abuse, sometimes after an accident, sometimes for those that have experienced trauma, secondary trauma, maybe they went to war, they saw people die. Then there are symptoms, there's negative alterations in mood. Sometimes they are happy, sometimes they're not happy. They are easily hypervigilant. Sometimes you are there, they are highly arousable. If the door opens, they are startled. Then there is avoidance. So they try to avoid people, they try to avoid certain situations. Some will even avoid, let's say if they had an accident, they will avoid even picking a car. Then they have intrusive thoughts as if the thing is going to happen. Then sometimes they exclude themselves and they have thoughts of self-harm. Yes, and I am an advocate for women, so I decided to put postpartum depression. Postpartum depression is on the rise, and not because our women are weak, but because our women are overwhelmed. And normally, these symptoms persist. Normally, when you deliver, there's something called postpartum blues. Postpartum blues are normal, and especially if you are primate, the first time you are giving birth, sometimes you feel as if you will be a good mother. You have these thoughts, but if these things persist for more than 2 weeks, continuous, low mood, you are not happy, you are easily tired, you are feeling anxious, you have negative thoughts that you will be a bad mom, your child will die, your husband will leave you, you are feeling guilty for no reason, you are avoiding people, you are easily angered, you don't feel a sense of fulfillment. Sometimes you're having thoughts of killing your child, thoughts of harming your child. Sometimes you don't even feel like breastfeeding your child because you feel you won't be a good mother. These are signs of postpartum depression. and we should be on the lookout, especially for mothers. And one of the things I'm advocating for is that, especially if women come on admission, pregnant women, and they deliver, sometimes just administering a simple questionnaire will help screen some of these things. Then there is postpartum psychosis. And there's postpartum psychosis. This is also a disorder after delivery. And in this, they have hallucinations, like I described. They are hearing voices, they are seeing images, they have delusions, they believe that people are trying to kill them, they are confused, they have suicidal thoughts, they are paranoid, they are not sleeping at night. So husbands and men here, we have to draw close to our wives when they deliver. It's a time that we have to be there for them. Is there treatment for mental health? Yes, there's treatment. There's psychotherapy, where you can do a cognitive behavioral therapy, what we call talk therapy. We'll talk to you, we'll find out where some of these things are coming from. There's also medication like antipsychotics, antidepressants, mood stabilizers, lithium. Then there's what we call complementary therapies like mindfulness-based stress. There is omega-3, some of these fatty acids, omega-3 fatty acids, acupuncture, art and music therapy is something that really helps. Good. Thank you very much. I'll pause here for discussions.
Okay, thank you very much, Dr. Aiddo, for such an educative session. We really do appreciate you. Please, Dr. Aiddo, I believe the questions are open for there's an open for questions now.
Yes, please. Yes, please. Open for questions now.
All right. So please, if you have any question, you can kindly raise up your hand and you'll be called, or you can put the question in the chat box and then I'll ask the questions for you. Okay, so Dr. Aiddo, myself, I have a question. So I would want to know, when a woman delivers and she starts to have the feeling of hating the child, not wanting to see the child, and I believe it's a sign of postpartum. So in this case, what is the patient supposed to do, or what is the patient supposed to be put on to be able to stop that feeling?
Okay, thank you very much. So, with postpartum depression, normally, if you pick up some of these signs, it's good to talk to a specialist, for the specialist to come and see. Most of the time, we have to do screening. There's something called the Edinburgh depression scale that is used to assess a woman with postpartum depression, to know the severity. So that if it's mild, we can just do psychotherapy and talk to the person. But if it's severe, we may have to start antidepressants. And normally, sertraline is a very good, and citalopram are good antidepressants that really work in postpartum depression. But ideally, you call for a consult. You call for a consult so that the person will be assessed thoroughly, because sometimes there may be other underlying issues that have to be dealt with. Thank you.
Okay,
I've seen a few questions in the chat box.
Yes, please. Okay, so why is it that many mental health patients do not like taking their drug? That's a question for Emmanuel Adai.
Okay, so the reason why most mental health patients are not adherent to treatment is because society and the stigmatization. Anytime somebody has a mental health illness, the society sometimes make the person feel like they are less than. So because of people feeling that they are less than, they don't even want to take the medication for people to think that they are less than. And sometimes when people get better on the medication, they feel like they don't need the medication again. And that is what has caused most of the relapses. But I would say that now we are doing not treatment compliance, we're doing treatment adherence. the clinician has to agree with the patient for them to come to a plan. So the plan I'm giving to my patient is not my decision. I give my clients all the possible options that are available. Then the clients will come to an agreement as to what will work best for the client. And because of treatment adherence now, now people are doing a lot better. And also, we shouldn't think that if anybody has a mental health disorder, the person is less than. And having a mental health disorder does not mean that you are not smart, you are not beautiful, you are not intelligent. It's just like people having chronic diseases. It does not make them less than. So we should also create the supportive atmosphere that people with mental health disorders can feel free to express themselves. Yes. Then somebody said that, is there a specific age brackets that are prone to mental health illnesses? No, so for all the diseases, for schizophrenia, the age is from 15 to 25 in males, then 25 to 35 in females. For mania or bipolar affective disorder, it is mostly from 15 to 29, both male and female. For depression, there is no age brackets like that, but it is mostly due to life stresses. Somebody said that, are there things one can do to avoid mental health disorders? I always say that um, keep your mental health space. Albert Ellis says that life is ABC. A is the activation event and C is the consequence. And he says the consequence depends on your belief system. That you can't control what people say to you. You can't control the way people treat you, but you can control the way you react. Let's say you're in a relationship and one somebody decides to leave you. If you hold on to the belief that you are not a good person, that's why the person left you, or that this person is the best thing that's happened to you, and because the person has left you means you are not worthy, you are feeling worthless and hopeless, you are more likely to be depressed. However, if you see that it's life happens and people come and people go, you cannot change, you cannot force people to love you, and you decide to say that I'll work on myself and get better, and maybe the next person will come and like me, then it means that you can move on from that pain and recover. So be careful who you let enter your mental health space. Also, if you're in a toxic space and a toxic relationship that is not helping you, please do well to leave. The other things we can do to avoid mental health disorder is even physically. We have to exercise. We have to be strong. We have to eat well. We have to sleep well. We have to watch what we eat, what we drink, and develop resilience. Developing resilience is your ability to adapt to changing circumstance. You should know expectations. You know what is expected of you. Sometimes we put so much pressure on ourselves. A young man, you are taking care of 3 people. You know that you are not capable of doing. Like I said, you should be able to realize your own ability. Sometimes you have to learn to tell people that, please, I can't do this at this time, and it goes a long way to help you protect your mental health.
Okay, thank you very much, Doc. Ivy wants to know the causes for depression. What causes depression?
Okay, so the causes of depression. So depression, sorry. So when we say the causes of depression does not have a cause, but there are risk factors for depression. One, if your relative has had depression, you are at a higher risk of having depression. People who go through trauma like childhood abuse, people who suffer a loss of a loved one, people who suffer loss of unemployment. There are also medical things like hypothyroidism. If you have a thyroid disorder, you are likely to have depression. Also, people who from infancy did not have any parental care or parental support are more likely to have depression. So there's no one particular cause, but a lot of things have to come together for somebody to have depression, like a few that I have mentioned here.
Okay, thank you very much. Please, any other question for Doc?
Please, I have a question. Please, can your mental health affect your digestive system? Like, can it give you inflammation or something like that?
Please, I didn't hear the last part.
I'm asking if your mental health can affect your digestive system.
Yes. Yes. So, like issues with depression, one of the things that if you are depressed, there are certain hormones that are released, like cortisol and all those things. And these are stress hormones. And these hormones sometimes you slow your digestion, sometimes you have constipation, sometimes there's decreased libido. They are somatic, we call them somatic symptoms. Like depression can manifest as a physical disease, and you lose appetite. Sometimes you are not, the food does not digest, you feel bloated. Sometimes you are feeling some tingling sensation, there is loss of sexual drive and all those things. So mental illness can manifest physically too. Yeah. So normally I tell people that if you have been treating chronic physical disorder, and most of the time it's not resolving, sometimes you have to check in and see a mental health expert or a psychiatrist to do a proper evaluation. Most of the time when they come, realize that there's an underlying depression or anxiety disorder that is actually presenting as a somatic disorder. There's a question that says that from Peter: how can an HR practitioner help a staff who refuses to accept that he needs help when it's obvious that the staff has any of the scenarios? Good. So every company has their company statutes and everything. One is that if the person, like we said, is affecting their productivity and is affecting their contribution at the workspace, as the HR, you have every right to write to the person to seek help. If the person does not want to seek help, then if the person is unproductive, you have every right to maybe lay the person off and let the person know that we think that you need help. So you go and see the specialist so that the specialist will assess and we will give a mental state report on the patient, whether the patient is fit to work or the patient needs help. Yes, so you can do that.
Okay, Doc. So, NM says often when we are angered by someone or even see exorbitant price tags on items we intend to buy, we occasionally talk to ourselves. Question. So the question is this normal or cause for alarm?
Okay, so talking to yourself is normal. Talking to yourself is normal in the sense that sometimes you have to, it's called reflection. Sometimes you reflect. You ask yourself questions. You ask yourself, am I doing well? Do I really need to buy this? It is a form of reflection. It is when talking to yourself when there is an external stimulus that maybe you are hearing a voice, you are seeing an image, and you are communicating with that image, that is what is considered abnormal. And also, if you talk to yourself, it is for a moment. I don't think you talk to yourself for the whole day. And if you are talking to yourself and somebody interrupts, you realize that say, hey, I forgot myself. Normally that's the response. So it is normal. We all talk to ourselves sometimes.
Okay, Doc. So how can one differentiate between normal stress and potential mental health condition?
So anything, stress is part of life. Like I said, if it affects your functioning, so let's say you are married, there's marital stress. But if this kind of stress in your marriage is affecting your sleep, you are not sleeping well, you are losing weight, you realize that you are angry out of proportion, you realize that when you go to work, you can't even work well, you realize that it is affecting all your relationships, you realize that it's affecting your happiness, it's taking your joy. If that particular stress is impairing significant function in your life, then it's causing mental health. But once in a while, we are all stressed from traffic, from economic issues, but we laugh about it and we slow down.
Okay. All right, Doc. So, Doc, are there specific lifestyle changes that can significantly impact mental health?
No, I didn't get the last part.
Are there specific lifestyle changes that can significantly impact mental health?
Yes, there are. So normally I used to have a chart. I was trying to find it. My laptop got frozen for some funny reason today. I was looking for a particular uh, a particular slide that I normally have. I'm still looking for it. If I find it, it's normally the slides. A minute.
Okay.
It's a slide I normally share about lifestyle things that people can do to help them to help them cope during normal stresses of during the normal stress of life. Sometimes, so some of the things you have to do is relax. I tell people that you should have time for yourself. Don't don't don't, don't say that because you are stressed out. You won't you won't take time to take care of yourself. Ah, good. I found a slide, so let me share it. Can you see my screen now?
Yes, Doc. Yes, please.
Good. So the first thing is slow down, keep calm, have a positive attitude towards life. I'm not saying that be positive even when you are in pain, but know that things will change. Understand? Have a positive attitude towards life. Take it easy on yourself. Learn to unplug. I tell you that sometimes you don't have to take work home. You don't have to take the stress of work home. There are times that you have to be able to create a partition. I'm home. Let me enjoy with my kids, my family. Enjoy life. Yes, I know the country is some way, but I tell people that fufu scan once in a while, go and sit somewhere, eat well, chill, have fun, breathe. Everybody, wherever you are, close your eyes, take a deep breath, count 1, 2, 3 in your head, then you release after that. So we go again. So when you take a deep breath, you count 1, 2, 3 in your head, then you release. Let's go. Take a deep breath, release. Realize that if you did it well, you feel like your shoulder, like a burden has left you. Deep breathing is free. Relax. Go outside. Listen to music and smile. Learn to smile. Meditation, like I said, do reflection. Reflect on your life. Have a heart of gratitude. In the long term, exercise regularly, eat well, practice mindfulness. Mindfulness is that there are things that you hear, you don't have to take it to heart. I tell people that sometimes when people say stuff about you, you don't have to take it serious. Move on. Maybe for a switch. In a short term, take a walk, practice deep breathing, like I said. Get a hug from a loved one. Married people, give yourself hugs. Kiss each other. Hug each other. It's therapeutic. Sometimes after a long day, give each other a hug. At home, express yourself, take action, get organized, create your own space. Husbands and wives, find some me time. At work, understand the expectation. One of the things I tell people that, let's say you are a nurse, you go to work, you know this was expected of you. You are not there to organize a prayer meeting. Do your work and go home. That's not a place you are going to sell your bag. Do your work and go home. Understand the expectations. Avoid multitasking if you can. Minimize conflict. There are issues that you can let go, let it go. Get comfortable in your workplace. Like, feel free, express yourself. If you are in a relationship, remove external stress. Actually, third-party people will spoil your relationship and give you pressure. If there's an issue, get to the root of the problem and talk about it. Don't be afraid. I talk about mature people can talk about issues and not feel like they'll break up. Save time for yourself. Improve your communication. Good.
Okay, thank you very much. So there's there's a hand up, but I have a question here, and I would like to ask that first. So someone wants to know if an older person bedwets, can it be a mental health issue, and what can be done to prevent it?
So, thank you for that question. Bedwetting. When we say bedwetting, actually, if somebody bedwet, it's either the father was either bedwetting or a grandfather was bedwetting. Somebody in the family should have had a history of bedwetting. And there's treatment. There's treatment for it. There's actually a very nice treatment. The person can just book an appointment and come and see me. It's a very elaborate thing. I have to write some things for you to follow. So maybe the person can book an appointment and see. But there's treatment for bedwetting. That's the person will not bedwet again. Like there is serious treatment for it. And it's not even medical. It's psychotherapy that we do. Somebody says that, are there any coping mechanisms to be deployed in achieving a sound mind? Yes, I've given you a few tips. Somebody said that habitual lateness. If somebody is late, sometimes they're just indisciplined. But you can also talk to the person. It could be that the person is depressed, and that's why the person is late all the time.
Okay. So I think Mercy's hand is up. Please, you can kindly unmute and then ask your question.
Okay, Mercy.
Good evening.
Hello.
Please, can you hear me?
Yeah, please ask your question.
Oh, okay. I didn't join from the start. I just saw it on one of my school pages. But I want to find out, okay, that if one is negative, okay, if you find yourself always uttering negative, like anytime you open your mouth, you just go negative. Maybe I can't do this, I can't do that, I'm unable to do this. Is it a sign of, a mental health issue? And then also when you are excessively afraid, almost like that you fear something is going to happen, is it also a mental issue?
Okay, thank you very much, Mercy. So if somebody is always thinking in the negative, I'm trying to remember this psychologist's name. Oh, why have I forgotten this? Yes, so there's a psychologist who said that if people get depressed, it's mostly they have a negative view of themselves, a negative view of the world, and a negative view of the future. That's because they think negative. Sometimes even the positives that are going on in their life, they cannot appreciate it. So then it will lead to a sense of low self-esteem, a sense of feeling of worthlessness, hopelessness, and guilt. That they feel like they are not doing anything. So it could be a foundation for a mental health disorder. It does not necessarily mean that the person has, but it could be a foundation for that. We may have to take further history to go deeper to find out if it is a mental health issue. And if somebody is consistently afraid we are all permitted to be anxious once in a while, but if it is persistent throughout the day, even the things that normally you are supposed to be able to get your mind off, the things still scares you and those things, it could be an anxiety disorder, and you may have to seek help.
Okay, thank you very much.
You're welcome. And the same is with the death. Somebody says in relation to death, it depends on how extensive it is. When it comes to mental health, you cannot just use one symptom. Normally, we have to talk extensively to know how deep it is.
Okay, so thank you, Doc. Lady, please, if you're on, you can kindly unmute and then ask your question.
Doc, please, I would like to ask, I have a brother. He all of a sudden started hearing voices and he was reacting to it. We took him to the psychiatric hospital. They gave him medication. He stopped at a point and he relapsed. So he relapsed twice, but now he is on the medication. I want to know if it is treatable. I mean, it can be dealt with forever because it looks like he has to be on the medication for life or something.
Yes, so thank you for the question. There are diseases that are chronic. I tell people that there are people who have been on antihypertensives for a very long time and they are still on it. I think that the problem with mental health is that if people are taking medication, we feel that they are not adequate. I don't know if any of you have watched this movie, A Beautiful Mind. It talks about a man called John Nash. John Nash is one of the greatest economists ever to have lived. He won a Nobel Prize for his work on what we call the game theory. And he lived with schizophrenia. And he was a lecturer at Princeton. And anytime he went off the medication, he relapsed. But he later found out that he has to be on the medication to be able to function. And this guy became a professor, won a Nobel Prize, just being on medication. So some things like schizophrenia is a chronic illness, and the patient may have to be on a medication for a very long time, sometimes for life. And I have clients who have been on medication for like 6, 7 years, and they are doing well. Some are doctors, some are nurses. They are doing well, and they are going about their profession. Some are even specialists. So I think it's a mindset change that we have to encourage them that this medicine is helping you. Most of the time, if you came and I told you that there is medicine, most of when you come for help. But when you come for the help and we tell you that the help is forever, people don't want to accept that. But you take antidiabetics, antihypertensives for a very long time and people do not complain. So it is more about we being open to mental health and knowing that it is manageable, like we can manage it. And as long as the person is functional, you should take it. Thank you.
Okay, thank you very much, Doc. I can see most of us hand up, but we have 9 minutes to go. And Doc, please, I would actually want to ask if you have some few minutes to spare, because there are 1 or 2 questions more to be answered.
Okay, I can spare 2 more questions.
Okay,
Hello?
thank you very much, Doc. Okay, so
Hello?
Mustafa, please you can go
Yes,
ahead.
Doc, good evening.
Yes, sir.
Yes, mine has to do with forgetfulness. No, recently I started experiencing such a thing. I want to learn. It's like you forget about what you have sort of
Yeah,
learned.
Mustafa,
So,
please. I didn't hear. I only heard the experiencing. I didn't hear the last part.
yes, I'm talking about, the forgetfulness. I started realizing that I've been forgetting about things, too early. So I want to find out whether it's also, sort of a mental health issue.
Okay, Mustafa, if I may ask, please, how old are you?
Oh, okay. Please, I'm roughly 45, 46.
Okay, good. So there is, as we age, there is an allowance for us to forget things.
Okay.
The problem comes if you are forgetting things that routinely you know. Let's say you are forgetting names of people that you know, like places that you used to know. You are driving and you get lost. Those are problems. The reason why we forget as we age is that when we were younger, our responsibilities were few. But as you age, you're thinking about school fees, you're thinking about your children, you're thinking about work, you're thinking about your colleagues, you're thinking about a lot of things you have to do. So sometimes information, the way our memory works is that if you get information, about only 15% is stored. So sometimes as we age, we have to learn to keep a diary. We have to learn to keep a diary. We have to learn to keep a calendar. We have to learn to keep some of these things to set reminders for us. Uh-huh. We are bound to forget things. The problem I'll have is if you are forgetting things that routinely you know how to do, things that routinely you are not supposed to forget. Like maybe the way you go about your business, all of a sudden you are forgetting how you go about the business. Then I am a little bit worried. But if it's somebody told you their name and you have to ask like 2 times before you remember, sometimes as you age, because of the amount of information we are receiving, you can't keep all of them at the same time. Yeah.
Doc, thank
Okay.
you.
Okay, thank you very much, Doc. And the last
If
question.
Doc can share his number, it will be fine. Some of us are far away from Accra. Okay. I will leave my contact. Okay, I'll type my contacts and I'll leave the contact to my consult, the email to my consult. If you call me and you don't get me, please text me. If you text me, use the code Ghana Canada so that I know that you came for this presentation and I give you the number.
Please,
Because
would
sometimes
the
people can get
Doc, please, would the slides be sent to us? I don't get access to some of them.
that one is mine. That one is my intellectual property. So maybe I'll think about it. After that, maybe I'll send it to you. And if they
Okay,
will
so
share it with you.
please, the webinar is actually recorded and it will be shared on our Friends of Ghana Canada page. We have a YouTube channel, so subscribers can actually subscribe to our Ghana Canada TV channel on YouTube, and you'll be able to get this particular webinar. So with regards to getting access to the webinar, yes, we are going to share it on our various social media platforms. That's our YouTube channel. You can get it on TikTok as well. We have a channel on TikTok too. So it will definitely be shared. Okay, so I guess that's all for the question. Okay, so Dr. Aiddo, we want to say a very big thank you to you for such an insightful session. We really do appreciate, and this has been a very educative session. I have learned a lot, and I believe participants have also learned a lot. Okay, so I would want to also appreciate all participants who participated today. We really do appreciate you for joining us. If this is your first time, we have a Friends of Ghana Canada page, a WhatsApp page, where we update participants with various webinars. So I've shared the link in the chat. You can click on the link and then join our Friends of Ghana Canada page, and then you will be able to get all our various webinars that we do every month. And also, if you would want to contact us, our number is 0537724334. Again, 0537724334. You can also, if you want to get to doc, also you can also, and you want to pass through us, you can also call the same number, 0537724334. Again, 0537724334. So you can also contact us on this line anytime you want to get to doc, and we will also be able to assist you. As I said earlier, we are on Facebook, Ghana Canada Medical Center. We are on TikTok, Ghana Canada Medical Center. We are on YouTube. We have a YouTube channel where we post all our webinars. So you can subscribe to our YouTube channel, get updated with all our updates we put there, and then you'll be able to see this particular webinar that we did today. So Dr. Aiddo, I want to say once again, thank you very much for your time. We do appreciate this, you for giving us such a beautiful lecture. And also to our participants again, we say thank you very much for joining us for today. So until next time, it is bye-bye from us at Ghana, Canada. And also, please don't forget to click on the link and join our WhatsApp page so that you will be updated with all our webinars and the next webinar. Thank you and have a good night. Bye-bye.